here it is. We are live now.
Okay, so we're good to start. It is 10 o'clock. I'll call this meeting to order. Good morning, everyone. It is our regular board meeting for the Board of Health on January 22nd. And we will start with the election of our vice chair, which we deferred from last meeting so that everyone was available to be here. So at this time, I will open the floor for nominations for the position of vice chair.
Oh yes, Madam Chair, I'd like to nominate Ann Eady.
Thank you. Second call for nominations for the position of vice chair.
I think Mr. Millen was going to second that motion.
Well, thank you, Mr. Millen. We don't do this often, so. Third and final call for nominations for the position of vice chair. Seeing none, the floor is closed, and I will ask Ann Eady, are you willing to accept the position of vice chair?
Well, if you place your faith in me, I will try to do my best. It's a busy time, and I'll try and take my turn as vice chair. Do a good job for you.
Thank you. So as there was no other nominations, you are acclaimed, and congratulations, Ann. You are now the vice chair of the Board of Health.
Thank you. Thank you.
Well done.
Thank you very much for stepping in, Ann. We appreciate it.
Yes.
Well, thanks. I'll maybe try and get rid of one or two of my other jobs at the municipality. Free up some time, but I find the Board of Health very interesting, and it's a crucial time for us, and so I'll try my part for the next year.
Thank you. Okay, item 3 is amendments to the agenda. Are there any amendments?
Madam Chair, there are 2 media releases that were issued since the agenda was sent, so I would request amendment to add them, please.
Okay, so we need a motion, correct, to put that on the agenda. I need a mover and seconder. So I'll take Brian O'Leary and Deputy Mayor Gordon Hicks. Okay, so we have Brian O'Leary and the Warden of Grey. All in favor?
Yes.
That's carried. Thank you. So, oh geez, I'm probably doing this out of order. We have the approval of the agenda. I need a mover and seconder to approve it. Chris Peabody and Brian O'Leary, all in favor? That's carried. Thank you. I'll get on to this. Item 5, is there a disclosure of pecuniary interest? Seeing none, if one should arise during the meeting, you may declare it then. Item 6, we have the adoption of the minutes. This is from Friday, December 18th. And I'll say there is one amendment where it says members present. Mitch Tulin is listed as chair, and that should be myself listed as chair. So I would ask for a mover and seconder to approve the minutes as amended. And I see Helen Clare and Selwyn Hicks. All in favor? That's carried. Thank you. Oh, sorry. Was there discussion with those minutes? You could tell it's the end of the week, right? Sorry. All right. Item 7, correspondence and news releases. So we're moving on. Is that Dr. Era? You'll take that one, or?
Yes, Madam Chair. So the correspondence, there is one correspondence from the City of Toronto opioid poisoning crisis, where the Board of Health for Toronto shared a 13-point plan for federal and provincial government to address the opioid crisis, a very important subject. We have, as a board, had multiple initiatives related to this, so the recommendation is to receive and I can go through the news releases, or if you wish to have a pause there for questions.
Are there any questions for correspondence? Brian Millen?
Thank you, Madam Chair. Dr. Era, I'm sure you're aware that in the media and social media, there seems to be at least some amount of blowback that because the pandemic has risen to the top of the list, and rightly so in my mind, that there seems to be a perception that public health is ignoring the opioid crisis. And I know that's not true. I know yourself and particularly Ian Reich have expended a lot of time and expertise on this, but is there a way we can try to reinforce that we're not ignoring the opioid, the drug crisis, so to speak?
Through you, Madam Chair, definitely, and to that end, we had a standing item on our agenda under the Medical Officer of Health updates on the subject, and from last meeting there was a direction to have a letter drafted to the different levels of government to remind the system that this should be the next emergency to deal with immediately after after the pandemic is addressed.
Okay, thank you.
Okay. Any other comments? Helen Claire?
Yeah, I think what I was understanding from my colleagues' earlier responses, is there a way that we can simultaneously, while we're dealing with COVID, reassure members of the public that we are not putting aside the opioid crisis? I don't know if there's a way that could be incorporated, or even a separate stream of a communication strategy. This is a very important issue, we all agree. And I think for people that are in those communities dealing with the opioid crisis as people immediately impacted personally or family members, I think that reassurance, that seeing that the Board of Health does have it in its sights, is an important thing, rather than the sense that seems to be out there that we're all consumed with COVID and everything else is being left to the side. So I just wanted, through you, Madam Chair, wonder if there is a way that we can perhaps incorporate that into a communication strategy, not to take cycles, certainly, but just something that we can do regularly to let the community know that we are aware and that we haven't dropped this.
Thank you, Helen Claire. Anne?
Through you, Madam Chair, we do have a working group in the area, and the public health leads this group. We continuously support the different core program for dealing with opiate that will never be on the site. Today, there will be a media release actually issued on the subject. And on weekly basis, we have an initiative related to opiate. I hear the request to actually have a strategy to continuously do it. I don't think I do believe the frequency we're dealing with both emergencies is quite the appropriate balance. If there is direction from the board to have more input into the opiate crisis as communication, we can definitely consider that. I still believe that we are striking the right balance with the situation at hand with both crises.
Thank you, Dr. Era. Anne, you had a comment?
Yes, so I just wondered, this communication then, how often do you put it on our Grey Bruce website? Regarding, yes, we are, our staff are, the COVID crisis is stretching our staff, stretching our resources, but we are still working at the opioid and intend to do more when possible, but there's still, and then if you can just I'm just wondering, just to reassure people, the press, that these things continue as much as is being done as possible during COVID. How often do you get that message out, Dr. Era?
Through you, Madam Chair, today, as I mentioned, there will be communication going out. Also, there is an interview with Rogers TV, and one of our managers, Ian Wright, who's leading that group, has an interview later today. We adjust the frequency based on the events in the community. If there are multiple overdose or death, we definitely up the communication, because that's the communication that's going to give people the heads up to be more careful and not to end up in an overdose. The work of the program of providing safe and use kits is continuous. Again, I realize the question about communication and the frequency. If the need be, we can go as 3 times a day, 3 times a week if the need be. Nevertheless, assigning different people to do the task, it really has to be balanced with the communication about the outbreak. Unfortunately, the opioid crisis is way more complex than the COVID crisis or emergency. And the complexity of it makes it, issuing a media release or communication frequently might not really change what the crisis is. It has to be multiple factors addressed at the same time. And in the middle of the emergency, of the pandemic emergency, there is no way to actually allocate more resources to do that. So again, I go back to say we are allocating in action and in communication sufficient input and balanced input. And I will finish again, since I hear the request from the board to have frequent communication or strategy to keep it on the front of the media, we can do this. I have no hesitation to allocate more. We just need to plan that this might affect the other response.
It might affect your response to COVID or
Correct.
Sorry.
Correct, it might affect the response to COVID.
Right.
If we have the health promoters team supporting the communication for COVID, and if we assign them back to going out in the community or to communicating about the opioid, the net benefit of that is not going to be it's not going to be huge. Just in the middle of the pandemic itself, the bulk of the work has been towards COVID, because that's where the immediate threat and the bulk of the benefit will happen. With opiate, everything we can do, we have been doing. So that is in place, well established. Communication, again, usually is proactive and reactive, and both of them are in place. We can up the frequency if that's a direction from the board.
Well, I'm just willing to, that's good to know. You're doing all you can, really, during COVID times, and you do have some communication, so that's fine with me. It's just good to know, good to have the details.
Okay, Brian O'Leary and then Brian Millen.
Thank you, Madam Chair. Just to Dr. Ara's point, we all do updates to our councils. At the end of the updates, we talk about infectious disease or other things that the health unit is doing. We can make an announcement at that time that we haven't forgotten about the opioid crisis. There's ongoing work, and maybe, Madam Chair, you can make an announcement at our Grey County meeting, and our colleagues on the Bruce side could do the same. I think that's effective as well. Thanks.
Yes, Brian Millen.
Thank you, Madam Chair. And to be clear, I wasn't trying to be critical. I wanted to make sure that Dr. Era and his team, and I think they're doing a tremendous job. I just wanted to make sure that they were aware that there is a perception amongst some of the community that we're ignoring or we're setting aside the opioid crisis until the pandemic is over. So, I mean, I wasn't advocating for a change necessarily, but just to reinforce that we can't necessarily separate one from the other. The community is concerned about both, very much so. So anyway, thank you.
Selwyn?
Thank you, Madam Chair. I do think that this is an important issue, but I'm not sure that the response necessarily has to come from public health. Public health is an important partner in the response to the to the drug situation. We do have the Grey Bruce drug strategy, and that's where a lot of effort, and I know that the Board of Health is a major partner in that. So I think the communication could very well come without drawing on the resources of public health, could come from that body, because that's the body that we've tasked to respond to that. They've done a terrific job. And I know that, you know, you will hear, for example, from the paramedics that it is an ongoing concern, perhaps somewhat elevated by COVID. People are experiencing psychosocial challenges. And opioid seems to be one of the things that they're using to respond. But certainly, I think we could work. Board of Health is working with the Grey Bruce drug strategy and could continue to work. Maybe they could be stepping up the communication that there's much on the go, and maybe the communication can come more from that body.
Okay. Good
Through you,
discussion.
Madam Chair,
Yes.
that's already in place, Mr. Warden. Like you rightly said, it's an issue that's addressed by multiple partners, by everybody around the table, and we have established our role as public health is to ensure there is response to it. It's not the sole response to public health to do this, like you rightly identified.
Okay, good discussion. Moving on, we have the news releases. Dr. Era, are there any you want to highlight, or does anyone want to ask questions about any of those specific? You can see how many there are that have been going out. So that's good, keeping everybody aware of what's going on. Alan?
Thanks, Madam Chair. I just wanted to make a comment. I think everyone's probably seen the people dancing in the street, or at least parents after the release that school's going back on Monday. Certainly some happy parents out there. And I think from Dr. Ayer's perspective, he could run for Prime Minister this week and get in. So just wanted to thank him for all the work that he's done on getting that new director for next week.
Thanks, Al. Dr. Era, any comments?
Thank you. It's collective effort from everybody around that table. The fact that we are in a relatively positive position would allow us to open school is definitely not only myself, the team here, the partners, everybody around the table. I would like to highlight one media release, Madam Chair. The Amish and Mennonite communities COVID collaboration was a few days, and it's worth emphasizing again for people who might be listening that these communities have been doing their part in ensuring the rest of Grey Bruce is safe. And it seems in the past few weeks we received comments, sometimes in the form of complaint, that the church service has been going on while the lockdown is in place. And I want to reassure the public through that media release that the majority of the community leaders consulted with us how to actually conduct a drive-through, and that is meeting the regulations. And I attest to it firsthand. They've been doing their part in the response.
Good. Selwyn, and then Chris.
Thank you, Madam Chair. At the same time that we're celebrating kids returning to school, and trust me, I have kids at home, and you're trying to run a business and trying to be a teacher and trying to get all these things done and find private places for each of them to do their thing. Certainly get that challenge, but let's not lose, let's not forget that there are many parents out there who have serious apprehension as well. I think we just have to acknowledge it's for quite a few parents. The return to school is one that they're cautious about, And so we can't let our guard down. We've done tremendously well in our area, but we have to keep the guard up and acknowledge that many parents are quite apprehensive, and rightfully so. I mean, this is, a pandemic, this is a killer. Not to cause panic or anything like that, but just to acknowledge that either way, you keep kids at home, and you've got this issue with, can they go to work, and can they, be a teacher and send them back to school? And now we have to worry about, parents who have apprehension about their precious little one going out in the world, and, what is there for them. I know that the schools have done a fantastic job. Our area has done a fantastic job. They will continue to follow proper procedures. It's important for our kids to have that social interaction. I know my own kids, the internet thing only does so much. It does not replace, that face-to-face teaching that happens in the school, and the interaction they have with their friends. But these are tough things, right? Either way, you can make the argument that there are going to be people concerned.
Thank you. Chris, and then Helen Claire.
I wanted to thank Dr. Era and his team for the communication in the media on the Mennonite and Amish community. I think it was just fantastic in dispelling that conflict that is out there, mainly on the Bruce County side with the Amish. And you did a great job, Dr. Era. I thought you really won the day on that one.
Thank you. Helen Claire.
Yes, that was precisely what I wanted to say as well, to expand a little bit. Just generally, the public relations, the quality of the public relations, the communications that are going out is extraordinary. And to give two specific examples, the opening of the schools, one of the media releases talked about, although it's confusing, that data supports that the cases are not happening inside the schools. I think that's where a lot of the confusion and blowback happens with regard to schools. When I'm looking at other regions in particular, when people are angry, they don't understand that basic fact. And yet Dr. Era's team, his communications team, are nailing that. And the same thing with the Mennonite community, by addressing what the issue is. That it would seem that people are complaining, they're lodging complaints because they have this legitimate concern. And Dr. Era's team again nailed that, explained what the issue was, and I think it's easier for people to understand the public relations when they are confronted with what that issue is. So I just wanted to, through you, express my appreciation at the quality of those media releases. Thank you.
Thank you.
Through you, Madam Chair, I just again want to connect the point that if this work has been successful, truly the heavy lifting has been happening through input from municipalities. In my meeting with the mayors on a weekly basis, when an issue repeats multiple times, that reflects the severity of it or the significance of it. And in one-on-one with different mayors, I got more information to actually be able to address it. So if there is success there, most of it, the bulk of the credit goes back to the political leaders in the area.
Thank you. Anne?
Yes, when we're on communication, I just wanted to say, Dr. Era, that I watched the Rogers, Bruce Power communication on different aspects of COVID and the community and initiatives on Wednesday night, I guess it was. And I thought it was great. Now that's the first time I'm aware that it's been on Rogers TV. And it was my mother that phoned me, and she's in her 90s, to tell me about it. She was so excited to get information firsthand. So I think that was very successful in reaching demographics that normally don't bother with Facebook Live or social media for presentations or websites, etc. So you did very well again, and so did the Bruce Power people. And they have contributed quite a bit to help us all throughout Bruce Grey and Huron counties during this COVID crisis and throughout the province. So it was very interesting for me to hear a review, and you always learn some new things. But I think that was great, because I think that reaches quite a few people. I don't know about Grey County, but Rogers TV reaches quite a few people in Bruce still. So thank you. That was good.
Okay. All right, anything further? Seeing none, I need a mover and seconder to receive the correspondence and news releases as presented. I have Chris Peabody and Edie, all in favor. That is carried. Thank you. Item 8 is the Medical Officer of Health update, and the first one is the COVID-19 vaccine update. Dr. Era.
Thank you, Madam Chair. So my update has three main verbal points. The plan for vaccination, for vaccine distribution in Grey Bruce has been completed, submitted to the Ministry on January 20th. We will be getting some feedback on it. However, it's an evergreen document based on the changes in the emergency. And if we can go, Aaron, to the first table of content, probably would be the most appropriate spot. If we can make it a bit smaller so the whole text could be there, please. So, Madam Chair, as you can see from the table of content, it's a comprehensive plan.
Dr. Era, I need to ask Aaron, I am seeing roll of the recorder.
Oh, sorry. I think might take a minute to catch up.
Okay.
So I will start talking about it. It's a comprehensive plan, starting with the purpose, the objective, the governance, and the different levels involved, whether it's the First Nation, federal government, the province, the priority population in the area, and the priority population within each subsector. That will cover the scenarios where we have limited supply of vaccine and how it's going to be provided to the people who would most benefit from it. Connie, would you be able to share the screen? Sorry, Madam Chair, we're having some technical.
It's me. I might close it and reopen it.
The logistics of it, whether the regular distribution of vaccine or the mass immunization hub, the financial aspect of the plan and how everything will be covered, data quality and documentation and evaluation of the entire plan and the execution of it for lessons learned for the future. It is, I believe, very excellent work from the team that was put together over the past months. Nevertheless, was refined in collaboration with other health units. There are a group of 7 medical officers of health. I am one of them, where we produced a template plan or a playbook to be distributed to all other health units. So this work would benefit many other areas in the province. So that's one aspect of the update. The other aspect is the task force had its meeting this first week. It was mainly introduction and just sharing the outline of the plans. And I do believe the coming few weeks would have significant implementation work, and in the long run until the end of the pandemic, it will be a very essential group in ensuring the buy-in from the public and the communication to the public. And the final part of the update, Madam Chair, is about the mass immunization hub. We are planning for 3 in Grey Bruce. I sent a request for a presentation to General Hillier. If there is no response in 2 days, I plan to send another one and send the plan to an immediate release to the public, and I do believe this is going to be an effective tool in this pandemic. I see the work that being done across the province, and I trust this will impress. So I'll stop there, Madam Chair, open to questions as always.
Okay, are there questions?
I have a question, Madam Chair.
Please go ahead.
Thank you. Dr. Era, is part of the task of this group going to be advocating for Grey Bruce to garner more and more timely vaccinations? The reason I ask that is that in spite of the good job that we and you and your team have done to keep the incidence of the pandemic low in Grey Bruce, it is frustrating because I know there are hospitals in the Waterloo region that have vaccinated their cafeteria staff, and yet we have got 200 doses. And in fact, a lot of our long-term care residents and staff, front line staff, are, it seems like, a distance off from having the option of getting a vaccine. And that seems rather unfair. And I'm wondering if you could speak to that, please.
Certainly, that brings a very important point, Councillor. The main criterion in the distribution in the province has been allocation of vaccine to high-risk areas. And because we are a low-risk area, we've been the victim of our own success. And if it shouldn't be a matter of advocacy, however, it seems to be. And that's where I mentioned if we don't get a response about piloting this hub in Grey Bruce and getting enough vaccine to distribute it to the high-risk individuals, I plan to basically utilize advocacy through the task force, through the different political leaders in the area, and the media as well. It shouldn't be a matter of advocacy, and we're working with the provincial government. I know our provincial colleagues doing their best, but it seems there are disparity in the distribution to a certain degree. We need to remember, Councillor, that the supply internationally has been affected. So the shipment that was planned for next week is not guaranteed anymore. And the 2 shipments in February to cover all the long-term care are not confirmed as well. So this has affected many areas in the province. Regardless, I do believe if we put our case forward, it will be a useful tool, whether it's used in Grey Bruce or in other parts of the province. But it should be, if advocacy is part of it, we will definitely consider that part too. Does that address the question, Councillor?
I get it does, and I absolutely support your approach. But I guess it goes back to my other comments somewhat regarding the opioid and versus the COVID. There are people in our community that are getting increasingly angry when they see other areas of the province championing that all of our long-term care residents and all of our long-term staff and all of our hospital staff have now been vaccinated. And yet here we sit in Grey Bruce with 200, and that's not going down real well. And I'm not trying to be critical of you and your team, absolutely not. But I guess I'm just venting a little bit of my frustration as well from what I see. So anyway, thank you very much. You don't need to try to salve my wounds. Thank you.
If I may, through you, Madam Chair, I hear your frustration, and I have the same concern. There is a trade-off there. If advocacy is used, we might be risking that we're not working with the province and in the eye of the public. I mean, the optics of it, as if there is divide in the response, and that by itself create lack of trust in one party or both. And I do believe it's a cornerstone in any emergency, specifically this emergency, that the system function as one unit. Nevertheless, the approach, as I mentioned, that it was in consultation with the chair, and we gave it enough thought to actually walk that line where we can advocate for the best for Grey Bruce residents without risking misperception from the public or from any party.
Okay, thank you.
Are there further questions or comments? If so, please just speak up, as I can't see the whole screen.
Madam Chair, it's Brian. I just want to add to that. I just want to mention that, and I've already said this to our MPP, someone down the road has to speak up and start talking about the reward system. And if Windsor and Peel and Toronto are having all these cases, it's because they're not doing the right thing. We have good numbers because we're doing what's right. And so just because the numbers are worse in Toronto, Windsor and Peel, and they've been doing the wrong things, they should not be rewarded with more vaccines. Honestly, I think it should be the opposite, and that's what we should be talking about. We should be pushing for that. The communities or municipalities that have been doing the right thing should be rewarded. But those are my comments.
Thank you.
Madam Chair, if I may comment on the comment.
Yes.
I do believe there is the same underlying principle there, that we can take it a step further to say, since we're doing really well here, if we get enough vaccine to put out the small fire here, all our resources would be deployed to help putting out the bigger fires in other parts of the province. So in essence, it's not either or, it's actually both, but starting with the area that's under control. And again, I realize that the provincial colleagues at whatever level they are working at, they're doing their best, and it's our duty to raise the case and give it enough attention. And as soon as it is heard, I believe there will be action. Nevertheless, it's a matter of time. It's not if, it's going to be when. If we don't get the vaccine in February, we're going to get it in enough quantity in March or April, and we'll be ready whenever that happens.
Thank you, Dr. Era.
Madam Chair, I know you can't see everyone. May I?
Yes, please go ahead, Selwyn.
So leave it to a well-known Liberal to compliment the Conservatives, but I'm going to do that because I have to tell you, I've been very impressed with the response that I've been seeing from our local MPP. So I've been able to attend meetings with Lisa Thompson, Mr. Pettipies, with Bill Walker. And, we have the luxury of having several people in cabinet, and they have been terrific. I have to say, they have been very terrific. I think that Dr. Era is on the right track, which is, we have done very, very well. And if we can show that we have this this proposal, we came out with that proposal very early in the game. I still remember the meeting with the general where, Mitch piped up and said, hey, look for something to come from Grey Bruce. If we can advocate that, look, we've done tremendously well. We are strong. We are prepared. We've got this plan. Through that, rather than sounding like sour grapes, we can sort of proactively say, we've got this proposal here and use us. We've done very well. We can be a model. And through that, we end up getting our fair share of vaccines, but at the same time, be able to play more of a leadership role. But I got to tell you, I think that our local, anyways, MPPs deserve credit. They have been just terrific, in my view.
Thank you. Selwyn, anything further? Okay, then let's, Dr. Era, please move on. 8.2, Public Health Modernization Update, if there is one.
There is no update at this point, Madam Chair. This file has not moved since the last meeting.
Okay, 8.3, Opioid Situation in Grey Bruce, standing item.
Thank you, Madam Chair. Truly, we had this discussion over the media releases, but truly, this is the key item on the agenda. There were I believe the number I heard, 10 overdoses in the past 2 weeks from communication with the EMS in Grey. Not death, rather just overdoses, luckily. By the end of the year, or when we look back at 2020, we had anecdotally over 13 deaths from opioid. We had 0 from COVID, and there is, by any criteria, that's not the best outcome for managing the opioid crisis. Nevertheless, as I mentioned, it is a very complex issue. It has many facets, whether it's social, it's technical, ethical, and you look at the trajectory of it starts even before birth, when there is pregnancy and enough nutrition was not there, and later early childhood development, and all these factors that would lead to a person at the end of the day falling off the wagon and using drugs. So to correct it, it wouldn't be as immediate as correcting the pandemic, the COVID pandemic crisis. And again, I'm trying to compare, not to say one is more important than the other. If you ask me which is more important, I would say the opiate, because there was death. However, the opportunity to address is definitely with the pandemic, because we can implement measures and we can prevent many, many deaths. The 85 broken family because people died because of COVID didn't happen in 2020 because of that response. So again, because we're doing really well, it's easy to say, let's do a bit more there, but it has not been easy on the team. I realize that if we're gonna send 2 FTEs to actually do a bit more there, it's gonna be a sequence in management requirement that it's not there. The capacity is not there. Our partners in Grey Bruce who are dealing with the opioid situation are doing a fantastic job. And during this period, we communicated to them that we will be supporting with the core issues. If, and not if, when the pandemic ends in the near future, I do believe we have an opportunity to address opioid in a way that we have never been able to do this. 2 years ago, people wouldn't know what public health does. And we will go to meetings and we send media releases about opioid. Many people might not read it or not give it that consideration. Over the pandemic, we've established enough credit that this credit could be cashed for addressing opioid. And this is something in the training of public health known to be, we earn our credit in health protection, which is infectious disease, and we spend it on health promotion, which is opioid. So the fact that, we're assigning different capacity to deal with the two is not because one is more important than the other. It's rather because the opportunity window to deal with the opioid is not here now. If we send 10 media releases about opioid, many people might not read them or read them negatively, saying, why are you not dealing with that? So again, I just to remind the audience who might be listening to us that it is on the agenda of the Board of Health, and it is very important. It's even more important. However, addressing the two issues require that balance.
Thank you, Dr. Era. Is there any further discussion or comments regarding this? Okay, so that is the update from the Medical Officer of Health, and I need a mover and seconder to receive those updates as presented. Brian O'Leary and Ann Eady, all in favor? That is carried. Thank you. Moving on. 9.0 corporate services. We have the financial report from November of 2020. So Matt, please.
Thank you, Madam Chair. So in the report, there's a couple of things to highlight. The first one is we had a funding announcement that was sent to us as a health unit, essentially saying for 2021, COVID expenses as we respond to the pandemic beyond our stated or natural budget will be covered by the ministry. There was no specific funding limit attached to that. It was just, it needed to be COVID related and beyond our normal established budget. The second part that I wanted to note was that the revenue that came in November had some additional bits that were not anticipated. They are one-time funding made up of two numbers. 21,000 that was part of an early adopter to the case and contact management software implementation. That was a bonus to us because we did join the early adopters. And the second one is when the government announced the school health nurse program, there was funding attached to that. And it came, our proportional share from August to November came as one lump in November. So that was a significant amount of $320,000. That's a $600,000 program over approximately 2 years. And then there's the rest of the commentary. When we looked at the COVID and the regular hours, there is a little bit of disparity in pay periods 22, 23, and 24. That's just our own internal allocation. We just need to resolve some of that process to make sure that we get it right. We do know we've got all the total hours are correct. It's just how they're apportioned. We'll solve that, and yep, the report will be updated. That's the financial report.
Okay, are there any questions regarding that report? I don't see any, and I believe at this time we need a motion to accept that report, correct?
Yes.
So Chris is moving it, and I have Brian Millen seconding. Thank you. All in favor? That's carried. And Mitch, I see you're on the line, but speak up if you want to move or second a motion. Thank you.
Well, Madam Chair, I have to turn my camera off. We've got bandwidth problems in the house here. Lots of online learning going on downstairs. So
I understand.
Yeah, but I'm here listening.
Maybe that's happening with Mitch too. Thanks. Okay, moving on, Matt, 9.2, board remuneration.
Thank you, Madam Chair. So this goes back to the ministry's audit approximately 2 years ago, when they started talking about how the board is remunerated. And so the conversation came up is that everyone but the chair is supposed to be remunerated by their respective county. The chair is to be remunerated through the Board of Health. Conversations, I think roughly a year ago, through both the board here and then subsequently with the two counties, had it set up so that would actually start in 2021. We are now in 2021. So instead of us paying for everyone but the chair, we'll continue to pay the chair. They will get it from their respective counties. We'll need to set up a reporting mechanism between ourselves and the respective counties so that all those in that spot will receive remuneration from their respective counties. So that's a piece of information. The amount, et cetera, is not being altered at this time. It's just who's paying ultimately for that.
Right. So that's just for information. Going back to there should be a letter going to each county, correct?
Yes.
Notice about what we're doing, which we've discussed. Any questions or comments about that? Okay, so that's just for information. Thank you. We will move on to other.
Madam Chair.
Oh, yes.
There's two other pieces attached to that. So I think we have the other parts of the conversation need to revolve around non-county members.
Oh.
And I think we have both Al Barfoot and Nick Saunders on that. So currently we have, and I think it would, the expectation is that we are paying both of those people until they are either appointed through the government, Ontario government as government appointees, or through the counties if they so choose in that regard. But until that, either of those two actions happen, we'll continue to pay both of those people.
Okay. Everyone's in agreement? Right. I see nodding heads, so, okay. Is that it then, Matt?
That is it. Sorry, Madam Chair.
No problem. Thank you. Okay, item 10 is other, and this is the Board of Health Executive Committee, the terms of reference. We need to review this now that we have an appointed member. So I just want to read what the terms of reference are, the first two sentences. The Executive Committee consists of the chair of the Grey Bruce Health Unit Board of Directors, who acts as committee chair, an appointed member of the Grey Bruce Health Unit Board of Directors, and an elected member of the Grey Bruce Health Unit Board of Directors. And then members of the Executive Committee shall be appointed annually. So the chair would be myself. The appointed member, we only have one, so it would be Helen Clare. And the elected member, we only have one other individual who is elected on this board, and that would be Anne. So we have our executive committee, but we do need to make it official and appoint with a motion. So unless there's discussion, I would take a mover and seconder. So I have both Brians moving, Brian Millen and Brian O'Leary second. Any further comments, discussions? Pretty straightforward when we only have one person appointed and only one person elected. So all in favor? That is carried. Thanks, Chris. Saw you there. That's good. All right. Item 10.2, Board of Health Policies Review. I asked to have this put on the agenda as I was reviewing the policies when I had some time to do some reading. And we are supposed to be, like, we can revise these policies, bylaws, and procedures when necessary, or at least every 2 years. So, and that's as per the Ontario Public Health Organizational Standards. The majority of our policies were updated and reviewed in 2016. And we have had some other ones updated since then. And I will ask Erin, you can probably tell us, you know, how many?
Yeah, so in 2019, there was 4. In 2018, there was 5. There's 39 policies altogether, so.
Okay, so, and the majority of these policies will not need to be changed, but they should be at least reviewed so that it's, you know, in the minutes that we've looked at them. But I'm wondering how the board feels with everything that's going on with COVID. Do we want to add more work to staff at the health unit, or do we want to do a couple of policies each month? Or shall we just defer for a short while? Lots of options. Comments? Helen Clare?
Sorry.
That's okay.
Yes, I don't think we should be adding more work to the staff. I think that as a board, we can look at it. If I was adding up correctly, that's 30 that haven't had a review in the last little bit. I'm not sure precisely how this Board of Health works, whether even a subcommittee, if that would be an interesting thing to have a subcommittee struck to just go through those 30 and review them and bring that back to the board, if that might be a useful idea.
Thank you for that. Any other comments? Al?
I was going to say, why not defer it till later in the summer and see how things go regarding the vaccination, and see if we're somewhat back to normal at that point. Might be a better time.
Thank you. Brian Millen?
Oh, I was just going to volunteer the executive committee to do this.
Thanks for that.
No, I in all honesty, I was going to suggest perhaps send the policies that need to be reviewed out to the board at large, and we can read through them, and if we think there's changes that need to be made, we can put another item on the agenda for a future meeting, and we could, if board members feel that there's changes or revisions that need to be made, we can raise them at that time and ask for some discussion, I guess.
Right.
I agree. I don't suppose there's going to be a lot of change needed.
Right. Okay, good. Anne?
I think we should just defer. I don't think it would matter if we just deferred for a few months with the current level of the health crisis. I think staff has enough on their plate, and most of us have enough on our plate, and especially with what's going on right now. So if we could wait a few months, I think that would be best, unless there's something really crucial that you flag or staff flags.
Okay. Selwyn?
Thank you, Madam Chair. I'm in the deferral camp as well. I think that the people with the real expertise are the staff, and the normal way of doing things is that staff give a review. They highlight some recommended changes, and then it comes to us and we have a good conversation about that, and it's either approved or further amendments made, and we move on. I think that's a good process. Our staff are quite busy right now. I don't think this is, if there's something that absolutely must be addressed, I'm certain that staff will bring it to our attention. But I think deferral is the right way to go.
Okay. I'm hearing majority, not quite majority. I haven't heard from everyone, but I am hearing that deferral is the preference. So that's good. We've had a discussion that will be in the minutes. And Aaron, I'll ask you to keep that on the calendar so that it comes up again, maybe when things hopefully are a little quieter at the end of the summer. Everyone, we're in agreement with that?
Yes.
Okay, good, thank you. Moving on, that's it. We'll move into in camera unless anyone has anything else they want to discuss. Okay, so I need a mover and seconder to go in camera. We have 3 items, litigation or potential litigation advice subject to solicitor-client privilege and security of property, moved by Councillor Brian O'Leary and Selwyn Hicks, seconder.
2 or 3 minutes following this meeting to talk to you, like by phone.
Yeah, okay.
It's just very short. I've got other meetings and things to do too. Okay.
Okay, are we?
We are back online, yes.
All right. So we are now back in open session, and I declare we only discussed the items that were on the closed meeting agenda. We adopted 2 sets of in-camera minutes. We gave direction to staff on 2 items, and 1 item was received for information. So that is the last item on our open meeting agenda, and I will ask for a mover and seconder for adjournment at 11:53. Brian Millen and Brian O'Leary, all in favor? That's carried. Thank you very much. Good meeting.
Thank you, Madam Chair.
Have a good day.
Thank you. Goodbye, everybody.
Toodles.